Good morning, and thank you for joining us. I'm pleased, as always, to be joined by Dr. Lawrence Lowe, Peel's Medical Officer of Health, Chief Nish Duriappa of Peel Regional Police, and Dr. Abdu Sharkawi, Internal Medicine and Infectious Diseases Specialist at the University Health Network. I want to start off by acknowledging that many Mississaugans are feeling anxious, tired, and disappointed. Many had plans for the holidays that have been cancelled, postponed, or scaled back. There is a lot of fatigue out there, and rightly so. We all want to go back to life, to normal, as we knew it. So many of us have done everything that was asked of us. We got our shots. We've worn our masks. We've stayed home when required. And yet, we're still in this position. While we're done with COVID, unfortunately, it's not done with us. But now is not the time to throw away our hard work. Now is the time to protect the health of our family, our friends, and our neighbors. I know it's not easy, but we can do this. This is not December 2020. So much has changed for the better. I'm hopeful that a brighter 2022 is ahead and that our residents will still find ways to celebrate by keeping it small and keeping it safe. Earlier this week, the Greater Toronto Area and Hamilton mayors held an emergency meeting in response to the rising Omicron threat. I can tell you that some of the issues we're encountering in our response to this new variant are the same right across the GTA. Capacity and resourcing remain big concerns. While booster eligibility has been significantly expanded, our public health units are working around the clock to ensure that we have enough healthcare workers and support staff to meet the current demand. To help with expansion efforts, my fellow mayors and chairs look forward to working with the province to help incentivize more pharmacies and doctors to offer vaccinations. We are not alone in this fight, and the only way we're going to be able to get as many boosters in arms as possible is by working together. But this will not happen overnight. Please be patient and be kind, especially to our healthcare workers who once again are stepping up to the plate. None of this would be possible without their unwavering dedication. They're burnt out, tired, and they too need a break. I salute these heroes because that's what they are, our heroes. To the team at Peel Public Health and Trillium Health Partners and the countless healthcare workers at clinics and practices across our city and beyond, you have my gratitude and that of a thankful province. And now for my COVID update. As you have seen or read in the news, the situation with the Omicron variant is changing quickly. In Mississauga, we're seeing a quick rise in cases and a significant demand for testing. The 7-day moving average increased to 136 new cases per day in Mississauga, and that's an increase of 87 cases per day over just a 1-week period. This variant is more transmissible, and with more gatherings over the holidays, we have to remain nimble with how we respond to it. Omicron is 4 to 6 times more transmissible than the Delta variant. We are seeing a rise in how easily the virus is spreading throughout the community. Importantly, however, fully vaccinated individuals who test positive typically have milder symptoms, and the good news is our ICUs are not overwhelmed at this time. And this is why it's crucial that everyone get their first 2 doses as soon as they are eligible to do their part to protect our hospital systems. I know that the 2 things that will help us get through this next wave are rapid tests and booster shots, and that's been challenging for some residents to access. With the recent eligibility being expanded to 18+, this means that nearly 1 million Peel residents can now get their booster. For context, earlier this year, it took us 5 months to vaccinate 600,000 people. I want you to know we're doing everything we can to support Dr. Lowe and his team in rolling out more booster shots by ramping up capacity and exploring new clinics in the new year. The good news is that our capacity continues to grow and more appointments are being added daily. Over 140,000 boosters have already been administered and nearly 80,000 doses are being delivered every single day in Peel, with more capacity coming online every day. I ask residents to be patient and kind as Peel Public Health works to ramp up boosters. Your turn is coming soon. And to the parents concerned about whether or not your kids are going back to school in January, I ask that if you have a child that is over the age of 5, please make it a priority to get their first dose as soon as possible. We continue to preserve pediatric capacity to ensure that these children can have access to their first 2 doses of protection. Using the rapid test kits sent home from your school can also help keep things safe over the holidays. This is the best way we can help keep our schools open. With regard to rapid testing, I know that Premier Ford is working very hard to secure more rapid tests and get them in the hands of people across the province this holiday season. The federal government has committed to another 180 million tests, which I hope are delivered to the province as soon as possible. It's all hands on deck right now. This is not the time to point fingers or blame, but to work together to keep people safe and to keep things open. Combined with vaccinations, these tests are a powerful weapon in our fight against Omicron. As we witnessed this past week at malls, GO stations, or LCBOs, there is a clear demand for these test kits, which is why I wrote a letter to the Premier and Minister Elliott to request that the province ramp up both the number of test kits and the locations of this holiday blitz, including expanding it to transit hubs and libraries in Mississauga. We must bring the test kits to the people and make it as easy as possible to access the tests. If upon valuation this pilot proves successful, I'd be very interested in seeing it continue into the new year and beyond. People who test positive using the kit should get a PCR test at a testing centre or participating pharmacy. The distribution of rapid test kits, therefore, must be accompanied by increased capacity at our testing centres. As we increase capacity for vaccinations and testing, we've had to limit capacity in other high-risk indoor settings. Last week, the province announced new measures to combat the spread of the variant. I know this is not the news that any of us wanted to hear going into the holidays. The new capacity limits apply to indoor settings such as recreation facilities, gyms, community centres, restaurants, and sports and entertainment venues, and have seen their capacities reduced by 50%. We have altered our city services to align with these new measures, which include closing our food and beverage stands in our sports facilities and reducing capacity where necessary. The province believes these measures will help slow the spread and give us time to roll out boosters, especially to our most vulnerable. If we are asking patrons to show proof of vaccination to enter certain businesses, it can only make sense that the staff at these facilities are also fully vaccinated or submit to routine testing to create the safest workplace environment possible. That being said, I'd welcome additional measures from the province that would help close this gap. Many companies have done their part and gone the extra mile to implement their own proof of vaccination policies for their employees. The City of Mississauga is one of them. I thank all the businesses that have implemented their own vaccination policies and for doing your part to create a safe working environment. I know mandating this is not an easy task and will require some legislative changes at the provincial level, but I know it's possible. Keeping Omicron at bay is going to take everything we have, and nothing should be off the table. As we get closer to the holidays, I want to remind everyone that gatherings are now limited to 10 people indoors and 25 outdoors. I know this means that many of you are adjusting your plans. While the timing is less than ideal, we know that unfortunately COVID does not take a holiday. We need to all think carefully and be more responsible when hosting or visiting with family and friends to make sure that we're doing everything possible to reduce the spread. If you choose to be a host of a gathering, please keep it small and keep it safe. If you have access to rapid tests, please take it before visiting your family and friends. If you have extra test kits, please share them with those you are gathering with this holiday season. If you test positive, please stay home and book a PCR test as soon as you can. I want to remind you that Peel has a free isolation center for our residents. If you come into contact with someone with COVID-19 or have symptoms and are not able to safely isolate in your own home, you can check into an isolation hotel. For more details, please call 905-281-1269. And with that, I'd now like to invite Dr. Lawrence Lowe up to provide his update. Over to you, Dr. Lowe.
Thank you so much, Madam Mayor. Good morning, everyone. It's great to be here with my colleague, Dr. Sharkaway, and also with and also with Chief Nish and his team. The Omicron variant has arrived in the region of Peel and Mississauga, and our situation is rapidly evolving. Cases in Mississauga last week are at 97.8 per 100,000, with a test positivity at 6.4%. At this point in time, 86% of our 5+ population has 1 dose and 81.1% have 2 doses of vaccine. And today, in accordance with provincial direction, we are shifting our case and contact management efforts towards focusing on high-risk settings to free up our staff to support our accelerated booster campaign. For those who test positive but are not connected to a high-risk setting, you will be contacted by the provincial workforce and they will ask you to isolate as well as give you instructions on how you can notify your close contacts so that they can protect themselves and their families. Please follow their instructions carefully. And I do want to be very clear that if you are not yet vaccinated or you do not have your 2 doses on board at this point in time, please get to 2 doses as quickly as possible. We are continuing to accept walk-ins at this time for adults who need their 1st or 2nd dose. That is the only walk-in that we're accepting at this point in time. All other appointments at our clinics are being booked. This is particularly as a result of the provincial decision to open eligibility to 18+, which has driven demand for booster doses in an overwhelming manner across the province of Ontario. We at Peel have added 65% capacity over the last week in our vaccination system, and we've also been adding thousands of appointments every day. But unfortunately, at this point in time, we are currently booked until early February. 900,000 people became eligible on Monday, and as Mayor Crombie spoke to, at full capacity in the spring, it took us nearly 6 months to vaccinate this many people. So I am really urging the community to please be patient and calm. Our team is working around the clock with partners to add more clinic locations, more hours of operation across the system. There will be pop-up clinics over the holidays, particularly clinics targeted at 50+, changes in operations to increase efficiency and flow. System capacity will increase through the next few weeks and into January. However, with the current capacity constraints, I must urge the community to try to help together to get our 50+ group vaccinated first. We know that this group in particular is at greatest risk of severity, even without the protection of a booster. So since we are facing an Omicron surge, we really want to ensure we get needles to the right arms as quickly as possible, because preliminary evidence does show that particularly 2 doses still do hold somewhat for severity, especially if you're younger. It's 2 is good, 3 is better for infection. So I'm asking, just like you would on a crowded subway, please consider giving your opportunity for booster, if you're younger, to someone in greater need, your parents, your grandparents, and the older members of our community. Please also note that we continue to preserve capacity for those aged 5 to 11 over the winter break. It's essential to protect this population for themselves against really rare severe outcomes, but also to ensure that we can really try to reduce exposures and outbreaks in elementary school settings, which is where we're seeing most of the activity in the fall term. So I urge parents, please get your children their first dose and start them on their journey of protection as soon as possible. Finally, for adults who remain unvaccinated, I'll reiterate again that you are at greatest risk at the moment if Omicron really starts to take off as it is now. If you are not vaccinated, I urge you to either avoid others as much as possible and reduce your contacts significantly, except for the most essential reasons, and I urge you to get vaccinated without delay. It is likely that we will all potentially face Omicron in the coming weeks and months, and you are at greatest risk of severe outcomes like hospitalization or intensive care, or worse, in the event that you are infected without having 2 doses on board. And while our hospitals are holding their own now, we know that they are stretched in trying to catch up with previous backlogs and deal with the impacts of the past 2 years of the pandemic. Any surge will be more difficult for our hospital partners to manage than previous waves. So we need to work together, and we can do this. If we get our 50+ boosted, our 5 to 11 protected, and help to reduce our contacts at least over the next few weeks while we see Omicron roll in and learn more about it, there is a way for us to stop the spread, drop hospitalizations and mortality, and continue to roll out the vaccine. So over the holiday season, I would urge everyone to please continue to stick to the precautions. I know we're tired of them, but they work to stop spread. So besides getting boosted, getting your first 2 doses if you're 5+, stay home if you're sick. Remember for gatherings that virtual is safest and smaller is better. Wear a mask as much as possible when you're indoors in public places or in crowds outdoors. And please continue to limit your contacts and help our older community members get boosted. I know it's not necessarily how we wanted to spend the holidays, but like an ice storm on Christmas Day, we need to adapt to the conditions as well. So please have a safe and happy holiday, and I'll pass it back to Mayor Crombie.
Thank you, Dr. Lowe. And now I'd like to invite Chief Nish Duriappa of Peel Regional Police up to the podium for his update. Thank you, Dr.
Thank you, Mayor Crombie, and good morning, everyone. On behalf of Peel Regional Police, we just want to reiterate that we continue to support the cities, the region, and Dr. Lowe's efforts to ensure that public health and safety is #1. But we also are very committed to the health and well-being of our community in a variety of different ways. And some of the messages I wanted to bring to you this morning pertain to road safety and making sure that over the holiday season you get to where you want to be in a safe and healthy way. And part of that is to ensure that at a time where distractions are higher than they normally are, we want to remind you to ensure that you prepare for yourself before your trip and before you get behind the wheel. Your full attention to driving is what gets people to where they need to be in a safe way. Ensure that you're wearing your seatbelt, driving well, watch for pedestrians at this time of year, but also ensure that you leave your cell phone in a place that you're not tempted to use it. But at the same time, we want to make sure that you are adjusting to the road and weather conditions that we're seeing at this day and age. Many of the road safety issues that we see are drivers not anticipating the road conditions. Please ensure that you look ahead. The general rule we say is if you can anticipate road safety issues 15 seconds ahead, then you're looking at the broader picture. But here in Peel Region, as many of you have seen in the news media, we've had a localized, high-profile, impaired driving-related fatality that has had a tragic effect on a family right here in our region. This is one of our greatest concerns here in Peel Region, is to ensure that you get to where you're going safely, but that you plan ahead. If you are consuming alcohol, please know that we want you to get to where you're going safely, plan for transit, ride share, taxi, Uber, whatever it might be. We know that here in Peel Region, impaired driving by drug and alcohol is one of our greatest priorities. We've seen an increase in impaired driving and stunt-related driving. And as such, Peel Regional Police have increased the number of officers and bolstered it to a number of about 100 men and women that are diligently working to keep the roads safe 7 days a week here in Peel Region. Please plan ahead. And remember that driving impaired is actually a criminal offense. We want you to call 911. If you see an impaired driver, please stay away from them, but ensure that you get to where you're going safely. Some additional crime prevention tips that we want to remember over the holidays is that please make sure that in the colder weather, you don't leave your car running unnecessarily and unattended. We do see an increase in theft of automobiles here in Peel Region. Generally speaking, a vehicle only needs about a minute to warm up, and that mitigates the need to start your car that much earlier. Also, if you're shopping and you have valuables in your car, please make sure that they're covered or locked in your trunk. One of the other things that we want to do to make sure that you have a healthy and enjoyable holiday season is that we look after your homes and your properties. If you're traveling over the holidays, please ensure that you have a neighbor or somebody look after your property, pick up the mail, make sure your driveways are shoveled. If you have timers for lights, that's a fantastic thing. Of course, doors and access points, make sure that they're locked. And if you're anticipating on going away on vacation, we know that many of you have changed your plans. Please do not post it to social media. The countdowns before you travel are also ones that we'd rather you do after you return from your travel or trips or time away with your family. On behalf of Peel Regional Police, we want to continue to encourage you to stay safe and keep Peel Region safe. All the men and women here at Peel Police are committed to the same thing. Thank you.
Thank you, Chief. Always an important reminder ahead of the holidays. We also have another special guest joining us virtually this week, and that is Dr. Abdu Sharkawi from Toronto Western Hospital. Over to you, Dr. Sharkawi, who is joining us virtually.
Good morning, Mayor Crombie. Thank you very much for the invitation today. And I want to begin by acknowledging that we are on the treaty lands of the Mississauga Indians of the Credit tribe and the Ashina. Sorry, I'm apologizing for pronouncing it incorrectly, but suffice it to say, I want to make sure that we acknowledge that we are on Indigenous treaty lands and not to ignore that today. And I also want to mention that it's disappointing that we're here. I understand and echo the sentiments of Mayor Crombie and Dr. Lowe and others. We didn't anticipate that we would be here in December of 2021 talking about further restrictions, talking about more difficulty, more uncertainty. And I think over the course of this pandemic, I think our enemies have been looking for certainty and looking for perfection. And our strengths have been identifying where we can accomplish things and where we can affect progress when we do things cooperatively and when we do things in a comprehensive fashion, not relying on one single method to protect ourselves against this virus. It's important to recognize that while vaccines are tremendously effective against every variant, that they cannot work alone. That when we talk about other important public health measures, such as limiting our contacts, masking, particularly when indoors, and using masks that fit well and are appropriate, particularly KN95 or N95 masks if we can access them. That helps tremendously. When we talk about getting tested, getting rapid tests done, doing other things that can identify the virus and prevent transmission within our homes to others, in our community, in our workplaces, that is a tremendous tool towards fighting this virus. And what we have to recognize that 5 waves into this, we have to do all of those things in combination in order to keep ourselves safe. While we would love to think that we can vaccinate ourselves out of this pandemic, we simply cannot. The vaccines must be supported by all of these other important risk mitigation strategies to keep ourselves safe. I use the analogy of two hands that need to clap together. And while our vaccines are a very strong right hand, the left hand includes all of these other important tools that can help identify disease early, prevent transmission, and keep ourselves safe. I want you to understand that while Omicron at this point in time has not flooded our emergency rooms and our ICUs, I am very reluctant to suggest that that situation is going to persist in the coming weeks and beyond the new year. While the trajectory towards hospitalizations and ICU admissions is certainly not the same as we have seen with Delta and other variants, we are seeing that hospitalizations and ICU admissions are starting to occur with Omicron as the prevalent variant of concern in places like Denmark, the United Kingdom, and other parts of Europe that are a few weeks ahead of us here in Ontario in terms of the rate of spread of this virus. That is something that cannot be underestimated. We have to acknowledge the fact that healthcare workers across the spectrum, whether you're talking about frontline workers in the emergency room and the ICU, our nurses everywhere, respiratory therapists, occupational therapists, infection control practitioners. We're talking about primary care practitioners as well. We're talking about everyone else within the community that is completely overtaxed. We are tired. Some of us have left the profession. We have lost nurses and vital staff within places like the ICU. As Omicron continues to spread, there will be further depletion within our healthcare ranks, which means that if you're sick and you show up to the emergency room, even if it's for a non-COVID related issue, it is going to be more difficult to meet your needs. That is a situation that cannot be accepted. We have to understand that our responsibility starts within our own home, within our own individual decisions, the behavior that we employ to determine what's going to happen to somebody we may not know several spheres away from our exposure. And that means when we make decisions about wearing masks indoors with non-household contacts, it's important and can have a ripple effect to somebody hundreds of miles away, somewhere else in the community who may be sick and may be vulnerable to transmission of this virus. It means that we need to take it seriously about wearing masks properly, not as chin warmers or accessories, but wearing them as tightly fitted, comfortably fitted devices that can help protect us against this virus. It means that we need to think about being creative, like opening windows, using whatever filtration devices we can so that if we are having gatherings within our homes, we're doing it as safely as possible. And it means, of course, getting vaccinated from every eligible point in time and everyone in our families. I'm pleased to say that all of my family, household members are now vaccinated. All three of my children under the age of 11 are vaccinated against this virus. This doesn't give me complete confidence that we're going to protect ourselves, but it's a very, very strong boost in the right direction. And my 5-year-old was the first of my 3 children to do it, and he was very proud, and I'm very proud of him. Let's remember moving forward that there is a lot of things that we can do to improve our situation. There is a lot of hope. We are working tirelessly to try and ensure that tools like rapid tests, that better masks that fit people and particularly at-risk populations in essential work environments, in schools, for our Uber drivers, our public transit employees, all of the people who do what we count on to make our community, our economy, our society function and thrive are protected. We need to do this. We can do this. We keep going back to the well and asking for more patience, for more resilience. And I know it's a tall order, but I know that the people within the community of Peel and across the GTA and throughout this great country have the resolve. They have the empathy, the compassion, the determination to make the right decisions, to do this the right way. I think 2022 is going to be a much better year. But the next few weeks in particular are going to be critical towards ensuring that we don't sleep on Omicron, and we make sure that when we move forward, we are doing it empowered as a cooperative, collaborative community, helping one another. Be kind, be patient, be hopeful. So we can do this together. I thank you very much for your time and your efforts, and I wish you all a very safe holiday season and a more hopeful new year.
Well, thank you for joining us, Dr. Sharkawi. Before we move into the questions portion of our press conference, I wanted to provide a little hope for the holidays. I encourage Mississauga residents to come out and enjoy Celebration Square skating rink while it's still here this winter. It's a great time to get some exercise and enjoy all that Mississauga has to offer. There are also many great trails, some of my favorites, Cullum Trail, Waterfront Trail, and sights to see in Mississauga over the holidays. We're also still very hopeful that we will be moving forward with the New Year's Eve fireworks on Celebration Square this New Year's Eve. We continue to monitor the situation and watch for any changes to outdoor event capacity from the province. We are putting extra measures in place to make this event as safe as possible, including spreading activities out around the square and encouraging masking outdoors. I want to wish everyone happy holidays, a very Merry Christmas, and a joyous New Year. And remember, when you shop or dine this holiday season, please support local. And however you celebrate the season, please stay safe. And now, along with Dr. Lowe, Chief Nish, and Dr. Sharkawi, we are happy to take questions from the media.
Our first question is from Declan with Mississauga. Go ahead, Declan.
Thank you. Good morning, Mayor Crombie.
Good morning, Declan.
I'm just wondering, I know the Ontario government is set to announce COVID relief help for businesses later today. I'm just wondering, the Shop Local campaign launched in Mississauga back in October. Have businesses here been telling you that that has helped in any meaningful way?
Well, certainly every measure helps, Declan. And from my perspective, I know that going up into the holiday season, there was a pent-up consumerism and everyone was benefiting, both the restaurants and the local retailers. And the 50% capacity will certainly put a damper in their profitability over the holiday season, but nonetheless, it has been a good season for them, and certainly the encouragement to shop local, support local businesses is always welcomed.
Declan, follow-up?
Yes, thank you. And just with respect to the rising case count, COVID case count in Mississauga, and maybe this is a question for Dr. Lowe, or you might know, I'm not sure. Are many of those cases, do you have the information that suggests many of those cases are from areas of Mississauga that you've previously identified as being below average in terms of vaccination rates, the south part of the city?
Right. You know what? That's a very good question. I am going to ask Dr. Lowe to address it, as it's Peel Public Health that does monitor the situation. I know that the City of Toronto announced data this morning that showed it was the downtown where the young people congregate, where the case counts are soaring. And we can ask Dr. Lowe if that's the same here in Mississauga, and certainly whether or not it's the Delta or Omicron variant that has been taking over this case surge. So Dr. Lowe, over to you.
Yes, thanks so much, Madam Mayor. Thank you for the question. So to be clear, prior to the arrival of Omicron, yes, we were still seeing significant transmission outbreaks in that setting. Right now, with the arrival of Omicron, we are now seeing a generalized surge across the community. So at this point in time, we are starting to see, the resumption of community transmission. And so this really is the reason why we're particularly concerned about people who are unvaccinated, because there are so many chains of transmission now that are out there, that there's an increasing possibility that we may have someone who hasn't yet had their 2 vaccines, and they may now be at a greater risk of contracting COVID, and then at a greater risk of having severe outcomes. So, certainly we are concerned about the neighborhoods where there are lower rates of vaccination, but at this point in time, as I said in my remarks, if you have 2 doses, that's a good foundation of base. We certainly want to be boosting, especially our 50+, getting 2 doses in for our 5 to 11s, and then really if you if you have no doses at this point in time, you should really be looking at essentially staying home, except for all the most essential reasons, because ultimately Omicron is spreading very quickly in our community, and until you get vaccinated, 14 days after your second dose, you are at a significantly higher risk than the rest of the general population. Thanks for the question.
Next question, please.
Our next question is from Uday from Globe and Mail. Go ahead, Uday.
Hi, my question is for Dr. Loh, and this is jumping off of the last question. So you seem to be identifying high-risk groups. Are you also looking at hotspots like previously were identified, like the L6P region in Brampton, for example? And I ask this because when I look at the list of pop-up sites from the Holiday Blitz, it seems like, Peel region kind of has been left behind. There are a few pop-up sites in Mississauga, and I don't think there's even a single one in Brampton. So is there a mismatch in terms of the need to test people rapidly in certain areas and the capacity available to test people, and how do you plan to address that?
So I'm not sure if you're talking about testing or vaccination. You started with vaccination and then you moved to testing. I'm going to address both of them. So in respect of our pop-up vaccination clinics, at this point in time, we are trying to essentially bring online and trying to figure out how we can bring online another mass clinic site in Mississauga. As you know, Mississauga's two main mass clinic sites, both Paramount and the University of Toronto at Mississauga, closed at the end of the spring campaign, whereas Brampton has continued to benefit from having a mass site at SaveMax. So there is no mismatch in respect to those vaccinations. Brampton, in fact, has had additional capacity because of having SaveMax, and we've been trying our very best to match that need and demand in Mississauga through pop-up vaccination clinics. In respect of testing, as you know, that is not something that I control in public health. That is something that's overseen by our Ontario Health partners. As has been throughout the pandemic, we are trying to make sure that testing is available. With the Omicron surge coming, it is important to note that testing capacity is going to increase is going to be challenged very quickly, and I understand that Dr. Kieran Moore will be issuing new testing guidance later this afternoon. The last thing I'll mention in respect of hotspots as a whole, with the advent of the vaccination coverage that we've had, it was previously identified in many previous press conferences that the hotspots had changed in our community. Largely, many of the neighborhoods in South Central and East Mississauga, where there's lower rates of vaccination, had initially been driving hospitalizations during the Delta surge. We will obviously continue to monitor trends at this point in time, but I think it is really a testament to the work of Peel Public Health and together with our community partners getting out to the L6P that has really changed the tail of the tape in that part of our community. Thanks so much for the question.
Do you have a follow-up, Uday?
Yeah, my follow-up has to do with outreach because Peel region in general has a very significant population of racialized communities, many of whom don't speak either English or French. So what is the plan for outreach to try and get those vaccination numbers up?
Thanks, Uday. Nothing has changed. We've had a community outreach table since the very beginning. And it's worth noting, we delivered our first vaccines on December 21st, 2020. Those community outreach tables also are made up of various subpopulation tables, including Black African Caribbean, South Asian, the Latino table. There's a whole list of tables, almost 20 in total, that have been targeting various populations. I'm obviously not going to list them all here, but I think the important thing to highlight is, working with community ambassadors, pop-up clinics. We've had clinics for international students. We've had clinics for workers. Nothing has changed in our strategy. We're going to continue to get boosters out as quickly and as quickly as humanly possible, especially through this holiday period. Thanks so much for the question.
Next question, please.
Our next question is from Natasha from The Pointer. Go ahead, Natasha.
Good morning.
Good morning, Natasha. How are you?
I'm doing well. I hope everyone else is well. I have two questions for Dr. Loh this morning.
No problem. Dr. Loh, you've had a busy morning.
It's all good. Thank you, Madam Mayor. Go ahead, Natasha.
So my first question, do you believe that we've reacted fast enough, or was it kind of inevitable to see this desperation for tests and vaccines again?
So Natasha, thanks so much for the question. I'm not sure. I think the best way to answer it, as I said in my remarks, certainly our priority is getting the 50-plus population over. I don't think anyone foresaw Omicron. If you did, then please let me know. And so I think certainly just at the speed at which this variant spreads, we're doing all we can to respond. And I think you have to remember many of the people who are working on this response, whether it is our partners at Ontario Health Testing or our partners, our team that has been vaccinating. These people have been working around the clock for the last year, 2.6 million doses delivered. So yeah, I think we're reacting as quickly as humanly possible, and we're grateful for the community's collaboration as we move forward on this. I think the question is maybe not necessarily recognizing the context as to how rapidly essentially things changed with Omicron arriving in our community, which is not unique to Peel. It's certainly something that really emerged across many different jurisdictions in Canada and internationally. So I think there needs to be a recognition of that fact. Thanks for the question.
Follow-up, Natasha?
Yes, and it's also for Dr. Lowe. So the province, as we know, has said that we can have gatherings up to 10 people right before the holidays. I'm wondering, do you think that it's safe if people take rapid tests before and then gather with people of different households up to that limit? Is that a smart idea for people to do?
I think I've said it very clearly. Obviously, virtual is safest. Smaller is safer. Rapid tests, as Dr. Sharkawi indicated, there are limitations to rapid tests. I think you need to be looking at the whole gamut, making sure folks are vaccinated, making sure that you are ventilating the room as much as possible, ensuring that you're wearing masks, particularly if anyone in your party is unvaccinated. I think at this point in time, really tightening your Christmas gathering, at least right now, for the next few weeks while we continue to address the surprise that Omicron has essentially provided us. There'll be plenty of time to celebrate, I think, in the new year. I think certainly as we get boosters out and continue to keep each other safe, the overall horizon and picture, I think, is going to be quite bright in the next little while. So again, virtual safest, smaller safer, and make sure that you're using all the different measures, not just relying singly on a rapid test. Thanks for the question.
Next question, please.
That was your final question for today.
Thank you all for joining us.